and welcome back to our YouTube channel. Today we are going to continue talking about depression. What are the different types, the symptoms, and some statistics to show how severe this problem is.
Keep in mind this segment will stretch over the course of 3 videos, so don't miss out on the next video when we upload it next week. Also, if you haven't already, go check out our last video linked over here.
As we did last time, we used the information we gained from a simple survey we conducted to notice what the public knows about anxiety. So today, we are going to be covering generalized anxiety disorder, panic disorder, phobia-related disorders, and others.
Already discussing general depression, it is now important to consider its symptoms. Depression includes feelings of sadness, tearfulness, emptiness or hopelessness, angry outbursts, irritability or frustration, even over small matters, loss of interest or pleasure in most or all normal activities such as sex, hobbies, or sports, sleep disturbances including insomnia or sleeping too much.
Tiredness and lack of energy, so even small tasks take extra effort. Reduced appetite and weight loss or increased cravings for food and weight gain, anxiety, agitation or restlessness, slow thinking, speaking, or body movements.
Feelings of worthlessness or guilt, fixating on past failures or self-blame, trouble thinking, concentrating, making decisions, and remembering things, frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts or suicide, and unexplained physical problems such as back pain or headaches.
Specifically with teens, the symptoms include sadness, irritability, feeling negative and worthless, anger, poor performance or poor attendance at school, feeling misunderstood and extremely sensitive, using recreational drugs or alcohol, eating or sleeping too much, self-harm, loss of interest in normal activities, and avoidance of social interaction.
Additionally, there are many factors that increase the risk of developing or triggering depression. This includes certain personality traits such as low self-esteem and being too dependent, self-critical or pessimistic, traumatic or stressful events such as physical or sexual abuse, the death or loss of a loved one, a difficult relationship, or financial problems.
It can also involve blood relatives with a history of depression, bipolar disorder, alcoholism, or suicide, being lesbian, gay, bisexual, or transgender, or having variations in the development of genital organs that aren't clearly male or female in an unsupportive situation.
Having a history of other mental health disorders such as anxiety disorder, eating disorders, or post-traumatic stress disorder, as well as abusing alcohol or recreational drugs can affect the triggering of depression.
It is also important to discuss different types of depression. This can include anxious distress, depression with unusual restlessness or worry about possible events or loss of control. There are also mixed features, which are simultaneous depression and mania, including elevated self-esteem, talking too much, and increased energy.
Depression can also have melancholic features, severe depression with lack of response to something that used to bring pleasure and associated with early morning awakening, worsened mood in the morning, major changes in appetite, and feelings of guilt or agitation.
Atypical features are also possible, which is depression that includes the ability to temporarily be cheered by happy events, increased appetite, excessive need for sleep, sensitivity to rejection, and a heavy feeling in the arms or legs. Psychotic features can also be common, which is depression accompanied by delusions or hallucinations, which may involve personal inadequacy or other negative themes.
Additionally, there is catatonia, which is depression that includes motor activity that involves either uncontrollable and purposeless movement or fixed and inflexible posture. Peripartum onset depression can also occur during pregnancy or in the weeks of months after delivery.
Seasonal pattern depression is the final type we are discussing, which is depression related to changes in seasons and reduced exposure to sunlight.
If you feel depressed, make an appointment to see your doctor or mental health professional as soon as you can. If you're reluctant to seek treatment, talk to a friend or a loved one, any healthcare professional, a faith leader, or someone else you trust.
If you think you may hurt yourself or attempt suicide, call 911 or your local emergency number immediately. Also consider these options if you're having suicidal thoughts. Call your doctor or mental health professional.
Call a suicide hotline number. In the U.S., call the National Suicide Prevention Lifeline at 1-800-273-TALK. Use that same number and press 1 to reach the Veterans Crisis Line.
Reach out to a close friend or loved one, or contact a minister, spiritual leader, or someone else in your faith community.
There are complications associated with depression such as excess weight or obesity, which can lead to heart disease and diabetes, pain or physical illness, alcohol or drug misuse, and self-mutilation such as cutting.
Overall, it is seen that depression is an issue that must be taken seriously. Without proper precautions, which we will be discussing in our next video, there is a chance for more detrimental consequences that are life-threatening.
If you want to learn more about depression disorders and what it is on the more fundamental level, we will have more statistics and websites linked in a blog post on our website. We will also be posting another video next week going more in depth about this issue.
Please remember that we are not professionals, and if you are dealing with an anxiety disorder or any other mental illness, please seek an adult or physician to confide in.
You can also call the suicide hotline at 1-800-273-8255. Don't be afraid to speak up.